In this segment of Ask the Expert, I'm here with Sarah Harjee, a registered nurse in the emergency department of McMaster Children's Hospital here in Hamilton. Thank you for joining me, Sarah.
You're welcome.
How did the social determinants of health play out in your role as a registered nurse in the emergency department?
I think that sometimes it's hard to see, especially when you're in such an acute care setting. My background, I'm very passionate about the social determinants of health, so it's really easy for me to walk into a room and sort of see all the underlying structural issues. But one of my frustrations sometimes, I think, with some of my colleagues is that they walk into a room and they see an asthma patient or a diabetes patient or someone that's there with a laceration. And I know that one of the things I'm sure a lot of people have talked about is that judgment. And sometimes we do judge our patients for those things. But if you take a step back, you actually see that every patient that walks through that door in some way or another has been affected by the social determinants of health, sometimes in a positive way, but more so, especially in the Hamilton catchment area, it's usually to some sort of detriment to their health. So I think being aware of those things is really important.
That's an excellent point, Sarah, particularly because you're seeing people downstream in the acute stage, but to rather focus on the upstream thinking. So, excellent point. Something that students have come across in the reading is the notion of intervening. And some of the criticism is that some of the interventions are oversimplified. In the reading, they do talk about intervention should be early in childhood, but also fairly intensive. What do you see working or not working in your role in the emergency department?
It's hard in the emerge to do interventions related to social determinants of health. I see patients come through. So, for example, I know I loved examples since I was a student in university, but one of the examples that I remember, this is sort of when I was first starting, a young gentleman came in and he was obese and had multiple risk factors for getting deep vein thrombosis, and so he was supposed to be on prophylaxis. And he had been to clinic visits before, and they had sort of gone through the fact that you need to start exercising more and you need to start taking these medications and you need to start looking after your health and losing that weight. And he came in and had bilateral leg DVTs. And I remember sitting around as I was getting the report, and one of my colleagues was saying, oh, well, he's just that fat kid. And he's just stupid because he's been told multiple times that he needs to get off his ass and start working out. And I don't know why he wasn't taking his medication. Wow. And sort of through the course of my shift, I got to know him a little bit better. And when you start hearing the stories, it's this young man came from a broken home, and he was being shuttled off from group home to group home. Wow. He didn't have a friend support and a friend structure. He didn't have that family helping him through that process. He didn't have the education to understand sort of what was being told to him in those clinic visits. And he didn't have the money to afford the medications that he needed. So that judgment that we gave him, as a patient, it's not always the patient's fault. Sometimes it's a failure of our personal support systems and our societal structures. And so going back to interventions, it's very difficult for me to do a strict intervention in the emergency department to fix all of those social issues. I think the best thing that I can do is, one, get social work involved because there are lifesavers in emergency, and they understand how to get that person in contact with those supports. But I think an important role is to recognize and to advocate for our patients. And that's at a policy level, at a municipal, provincial, or federal level. It's recognizing that this patient is a failure of our system and that we need to ensure that this patient has access to education opportunities, because maybe he dropped out of high school because of his family problems. Mm-hmm. So making sure that he has access to perhaps like alternative education systems. Mm-hmm. Ensuring that he has access to minimum wage that actually supports it, that's actually a living wage for him, so that he can afford the food that our clinic is recommending that he eats, mm-hmm. that he can afford the transportation to his job, that he can afford the medications, that he can afford appropriate housing, and that he isn't necessarily being shuttled off from group home to group home. there's lots of things that we should be advocating for this patient, but I think at the end of the day, we can't judge him for being non-compliant because it is a failure of the system, and you see it multiple times with a lot of the patients, especially when they have chronic issues. We think that they should be doing things, but really it's beyond their power, and they're essentially powerless to actually make those changes that we want to see, and that will make them healthy in the long run.
Well, that's a powerful example, Sarah. Thank you for sharing that. I think I want to touch on something that you said, and that is to recognize, to ask, and to advocate. I really like that. I think those are sort of powerful things that we can remember, anyone in the healthcare system in dealing with patients. Are there any pearls of wisdom that you would pass on to future nurses or nursing students as it relates to your role or any role that future nurses may have as it relates to the social determinants of health?
I think you did a good job of summing up what I was thinking. However, I do have 4 pearls of wisdom that I think are applicable as acute care nurses, but also just as general citizens. So the first one would be, when you walk into a room, don't judge your patient. You need to recognize that there's a broader story. And sometimes that's difficult to do in an acute care setting, but just taking the time to listen to what they're saying or to recognize what they're trying to tell you. The second one would be, now that you've recognized it, I know that it's sometimes a Band-Aid approach, but you need to figure out what possible supports are available to assist that person in reaching their most optimal health. So I mentioned social work as one. And that's sort of my go-to when I'm in Emerge, just because it's such an acute care setting. But the second one is, I'm going to give another example that I had of an acute asthmatic patient that came through, and we see this a lot of times, where the family can't afford the aero chamber, which helps dispense the puffers, and you essentially need that device for proper administration of this drug, but they cost $60 to $80 when they're out in the community. So sometimes I always make sure to ask whether the individual has health insurance. And that's sort of my practice, because I know that if they don't have health insurance, they might not be able to afford that $60 to $80.
Sure.
So trying to figure out how I can possibly get that individual an aero chamber for a reduced cost or for free, if possible. So keeping that in the back of your mind, that when you're discharging patients, you need to ask those questions and hook them up with the right supports, because otherwise they're just going to be coming back in a week or 2 weeks. And they're going to become that eye roll patient where you're like, Jesus, you should have figured out how to stay out of here. The third thing I have to say is become an engaged citizen. I think it's your duty as a nurse, perhaps, because you're working so intimately with these people, to become knowledgeable about these issues. And sometimes that's hard to do, but what I say to sort of my colleagues and my students and my friends is sit down and watch the news for 30 minutes a day. And as you're watching it, just think in the back of your mind, one, how is this going to affect me as a person? How is this going to impact me as a healthcare provider? And how is this going to impact my patients? And I think if you sort of think about those 3 things as you're watching the news, you'll get a different perspective about what's happening in the world. And I'm not just talking about specifics to healthcare, but I'm talking about policies that are related to employment. Trade policies are important because trade eventually trickles down into things like employment. Looking at education policies, the Aboriginal policies, they all are so interconnected in today's society that you need to be aware of how everything kind of works together. Absolutely. And I think the 4th thing for me is to educate others. So people sometimes ask me, well, it's at a policy level. How am I going to change this? Well, change won't happen if you don't have those conversations with people. You need to, I'm that crazy person that at dinner, I'm like, hey mom, hey dad, let's talk about the new conservative policies. And I think my parents are getting slightly annoyed about it, but if you have those conversations with people, you're starting to educate people. And I think change needs to sometimes happen at a grassroots level, because politicians won't make the change unless they start hearing a rumbling. And I think as nurses, we're in a position where people respect our sort of thoughts, and they look up to us. And I think we have a duty to sort of educate people to say that it's not just about giving medication, but it's providing these people with some sort of standard of living to prevent all of these diseases from happening down the road. Mm-hmm. And you can always use the argument that economically, prevention is, what is the quote? An ounce of prevention is worth a pound of cure.
Absolutely.
And that's what you see. If you give that patient a $60 or $80 aero chamber for free, you're potentially saving a $2,000 hospital visit down the road when they come in an acute crisis.
Absolutely.
So I think people tend to respond better to economics. So if you give those examples, they're better able to respond to those things. So
wonderful.
Those are my 4 thoughts.
Wonderful. Well, thank you so much for that insight, Sarah, and the
welcome.
Benjamin Franklin quote, and that will not be a multiple choice test question. And I think you really hit home the message of nurses being advocates for social justice. So thank you very much for your time.
You're welcome.